I'm Donna Rolfe. I'm one of the Health Services Managers in the Surgical Program at Fraser Health. One of my departments is the National Surgical Quality Improvement Program. All of our teamwork and all of our initiatives are all geared so that you have a great surgical experience. I'm glad that you've chosen Fraser Health for your care, and we look forward to taking care of you and as we work towards better outcomes for all of our patients in British Columbia.
Hi, my name is Suzanne, and I'm one of 2 quality improvement consultants for Fraser Health Nisquik. I have what is possibly the best job at Fraser Health. I work with frontline staff on action teams to help them meet their goals. I also work with their managers to ensure that frontline staff have the time, the tools, and the resources they need to succeed. In addition, I work with surgical clinical reviewers from Nisquik, Fraser Health, to ensure that the data they collect and analyze is well used by the teams. It's a winning combination, so we have clinical expertise from the frontline nurses, QI expertise, and data expertise, and the result is improved patient outcomes and engaged staff.
Hi, my name is Joseph, and I'm a registered nurse on orthopedics on Surrey Memorial Hospital. Pneumonia is the inflammation of the lungs caused by bacteria or viruses after your surgery. Some signs and symptoms of pneumonia can be fever, chills, shortness of breath, chest pain, colored sputum, cough, or dry cough.
I'm Kathy Boulderson. I'm the clinical coordinator for the surgical daycare and the pre-admission clinic at Jimmy Pattison Outpatient Care and Surgical Center. Risk factors for developing pneumonia can include increased age, smoking, pre-existing heart and lung conditions, and the ability to move around. Surgery is also a risk factor depending on where the surgery is located, how long the surgery takes, and how well your pain is controlled following, and these are things that you can discuss with your surgeon.
Hi, my name is Lucas. I'm a physiotherapist working at Peace Arch Hospital, and I'm part of the Pneumonia Prevention Action Team. There's many different things you can do to prevent pneumonia. The one I'm going to talk about is deep breathing and coughing. So the best way to do this would be to sit up at the side of the bed if you're able to. If not, you can do it in the bed. And what you want to try to do is breathe from the belly. So breathing in through the nose to start. And you want to feel like your stomach's rising, and then as you breathe out through your mouth, it should settle back down. So the idea is in through the nose, out through pursed lips, like you're blowing out some birthday candles. So take another look. You can try a couple of deep breaths like that, and then try a nice strong cough. If you've got a surgery scar, the best way to do it is holding a pillow up against the scar to help minimize movement and pain there, and that'll make it more comfortable for you.
My name is Kovinder. I'm the registered nurse here at Peace Arch Hospital on second floor surgical, and I am the team leader for pneumonia prevention team here at Peace Arch. One of the things you can do to prevent pneumonia after surgery is to have the head of your bed raised to at least 30 degrees or higher.
Use the buttons on the sides of your bed to move it up and down to make sure you are at 30 degrees or higher. Ensure that you or your nurse checks underneath your bed to confirm that you are at 30 degrees or higher while sitting in bed. Use the arrow to confirm the angle. Use the incentive spirometer as shown to you by your nurse. Ensure that you brush your teeth or dentures twice a day to keep your mouth clean. Try sitting on the edge of your bed after your surgery with the help of your nurse. If you feel comfortable and it is safe to do so, try getting up and walking around. If you can, try and sit up in your chair for all of your meals.
I'm Pavin. I work as a surgical clinical reviewer at Surrey Memorial Hospital. Each NISCOP site has an experienced nurse who undergoes rigorous training with the NISCOP program to work as a surgical clinical reviewer. Our role includes collecting and submitting high-quality data to the NSQIP database, analyze the data to identify opportunities for clinical quality improvement at our specific hospital sites. The changes in data trends show us the improvement as we work towards our goals of reducing post-operative complications for our surgical patients.
My name is John Wong. I'm a general surgeon at Sarge Hospital. Patient involvement is very important. There are several things they can do to avoid pneumonias. Number one, something that's not well understood is that in normal patients, in people who aren't in the post-operative period, they take several sighs, they take deep breaths that clear their respiratory lung secretions every couple of minutes. So anything that we can do to get them up and about right after their surgery, walking around, ambulating right away is really important. In addition, patients will notice that they're sitting up in bed rather than lying flat because that reduces the aspiration risk. And finally, anything that patients can do to increase their health before their surgery is really important too. If they can stop smoking, that's very important. If they can remind themselves in the post-operative period just to be up and about, taking deep breaths, coughing up any secretions, that's very important. Together, you and I can